Hello. This is Tokyo Anesthesiology Clinic. This is Special Edition, Ep.5. In the previous episode, we talked about how, even with the same ketamine, the way it takes hold and the sense of response can differ. Behind those differences, the autonomic nervous system and the condition before treatment may be involved. That was the topic. This time, we will continue from there. Why does the doctor think that simply administering the medication is not enough? Music, the atmosphere of the room, comfort, a sense of safety. Why are these things important? Today, we will ask our director, Dr. Tori. This video provides medical information for a general audience. We do not provide individual diagnoses or treatment advice. If you have symptoms, please seek evaluation at a medical institution. In an emergency, please use emergency medical services. This video uses the director's AI avatar, synthetic voice, and synthetic video. The content is supervised by the director.
Hello, I am Dr. Tori, the director. First, I will state the conclusion. Ketamine therapy is not a treatment based only on medication. Music, brightness, quietness, scent, texture, and a sense of safety. These things are also part of treatment. They are not decorations, they are not luxuries. They help regulate the autonomic nervous system and the emotional system and create a condition where ketamine can take hold more easily. That is how I think about it.
Doctor, what do you mean here by set and setting?
To put it simply, set means the condition of the person receiving treatment, the mood that day, anxiety, tension, expectations, fatigue, sleep, those kinds of things. Setting means the external environment, sound, light, the atmosphere of the room, scent, temperature, the presence of people, whether the person can feel safe, all of these things. Today, I will focus especially on setting.
Why is it so important? It is not simply a matter of making the room quiet, is it?
No, it is not simply about making the room quiet. With ketamine, if there is too much stimulation from the outside or too little stimulation, the way it takes hold can become unsettled. What matters is whether the person can feel safe and move inward. In other words, whether the brain and body can feel, this place is safe. For that reason, we need to prepare not only for music and atmosphere, but also the way people interact with the patient.
First, please tell us about music. Is music really that important?
Yes, it is important. I think music can change the direction of the experience, what attention moves towards, how deeply the person can enter, whether anxiety is likely to arise during the session. Music is deeply related to these things. What matters is not whether the music is famous. What matters is whether it fits that person. At our clinic, the music is not the same for everyone. People with strong depression or anxiety, people with strong trauma-related suffering, people whose pain or fatigue is at the forefront, people for whom a meditative or self-exploration direction fits, such as spiritual pain. For each of these themes, the direction that is easier to enter can be different. So, we place importance on choosing something that seems suitable while discussing it with the doctor.
So music is not just background music, is that right?
That is right. It is not enough for music to simply be playing. Music that doesn't fit can sometimes get in the way. On the other hand, music that fits can resonate with the person's inner state and make it easier to move inward. It can also help gather attention that might otherwise get scattered. I think that point is very important.
Besides music, what else is important?
Almost everything that enters through the five senses, the lighting of the room, quietness, the ability to feel calm, smell, and so on. In short, an environment where the five senses can become neutral. This is not about luxury, it's about adjusting the amount of stimulation. It's about designing a sense of safety. For example, at our clinic, we make efforts not only in how music is selected, but also scent and the feel of materials so that everything moves in a calming direction. But the essence is not about equipment. In any facility, the question is how much of an environment can be created where the person can feel safe and move inward. That is what I think matters.
This is a little difficult, but how does this work inside the brain?
This is easier to understand with a diagram. Ketamine tends to work in a direction that temporarily loosens fixed ways of thinking and feeling. However, where that change goes is influenced by the state of the body and mind at that moment. The foundation is the autonomic nervous system and the systems related to emotion. When that foundation is calm, the salience network might work more smoothly. Salience is related to what is important and what attention should turn towards. It's involved in that switching process. From there, changes connect to networks related to bodily sensation and movement and to networks that organize thought.
In other words, music and a sense of safety are not just about mood. They help regulate the autonomic nervous system and the emotional system and create a foundation where ketamine can take hold more easily. Is that correct?
Yes, that understanding is correct. I believe ketamine is something that is not completed by medication alone. First, the body and nervous system need to feel that this place is safe. When that is present, the way ketamine takes hold can change.
At this point, many people may be concerned about what is often called a bad trip. Can this happen during ketamine treatment in a clinic?
Here, I want to be careful with the wording. In the context of drug use, there is something people call a bad trip. However, at least at our clinic, over more than 20 years and several thousand cases, we have not seen that kind of intense bad trip. To clarify, temporary anxiety or confusion can occur, but this is completely different from being left alone. A nurse is nearby, a doctor is also available. When help is needed, help is there. I believe that sense of safety is extremely important.
So the sense of safety itself is part of the setting.
Exactly. What if I cannot move? What if something strange happens? What if no one helps me? These kinds of anxieties strongly tense the autonomic nervous system and the emotional system. On the other hand, if the person can feel this place is protected and support is available when needed, the way they enter the experience can change. I believe that is also part of treatment.
So you don't see setting as something secondary?
No. Rather, I see it as the foundation. The medication is important, but how that medication takes hold can change depending on the setting. That is why I believe simply administering the medication is not enough.
For viewers, is there a safe way to take this message home?
Yes, there are 3 takeaways today. First, ketamine therapy is not a treatment based only on medication. Second, music, quietness, brightness, scent, and a sense of safety. These aspects of setting are related to the autonomic nervous system and the emotional system. Third, what matters is not a dramatic experience, but entering safely and connecting the experience to what comes afterwards.
Finally, if you were to summarize this in one sentence, what would you say?
Setting is not decoration, it is the foundation of treatment.
Thank you. Music, the atmosphere of the room, comfort, a sense of safety. These things are not just staging, they are also part of treatment. That was today's topic. Next time, we will move on to what happens after treatment. How should the days after ketamine be spent? Why are the 3 days after treatment important? That will be our topic. This channel provides information for a general audience. We cannot respond to individual medical consultations. Thank you for watching today.
Thank you very much.